Look at that.
Now we need you to unmute this.
To unmute.
Ask to unmute. There it is.
There we go. All right, we figured out technology.
No.
Here we go.
Oh, okay. Is it recording? It's recording.
All right, let me throw on. Yeah.
All right. I'm sorry for
Lord
the foolishness.
Jeremy.
Lord
No.
Jeremy is in the house.
Do I need to curtsy?
Yes, that was appropriate.
Thank
for
you.
my title.
Yeah.
I've been in front of royals before.
I have not.
Oh, excellent.
This is the first time for me. So Jeremy,
Yes.
give me an introduction of Lord Jeremy for the people.
Well, I'm Jeremy Counts, also known as Hokey Farm, also known as Lord Dr. Jeremy, also known as El Presidente, LP, El Prez. A lot of nicknames throughout my life, but yeah, I am the owner and pharmacist in charge of Main Street Pharmacy in Blacksburg. But most of all, I am on the executive board of Pharmacists United for Truth and Transparency, and I spend a lot of my time doing advocacy and pushing bills and talking to people behind the scenes and really just trying to make a difference.
I love that. And I had the pleasure, Claudia and I both had the pleasure of meeting you in person, in the flesh, at the Express Scripts protest in St. Louis, Missouri, which was great fun. And we love ourselves some Lord Jeremy and Hokey pharmacists. So we are big fans of what you're doing, and we stand shoulder to shoulder with our independent pharmacists. What is happening in the world of your independent pharmacy right now?
Oh God, it's a shit show. Like everyone's just hemorrhaging money. Not just my farm, it's all of them. It's like you're spending all this money, millions a year on inventory, and you're getting hardly anything in return. And you can have 5 million side hustles, but whenever your primary function of dispensing is not economically viable, there's no way to actually run a business the way you're supposed to. And we don't even know what we're paid. Like we get a reimbursement, even with the Part D moving the DIR fees up front. You've still got on commercial claims, you got like the effective rates, and they do true ups at the end of the year. You never know what kind of money you're making. How are you supposed to run a business that way?
Walgreens can't even stay in business.
No, they can't. And they get their drugs a lot cheaper than we do, which is ridiculous because we've got excellent buying groups. And they still get their drugs much cheaper than us. So they've got all of these advantages. And I was taking a look at the 340B data here in Virginia, and they also have a ton of 340B contracts. So they're getting cheap drugs. They get all these markups, and they still can't stay in business. And people expect independence to like come out here and take care of their communities. It's not possible. And everyone talks about, oh, well, we just need to realign incentives. You can't fucking realign incentives on a vertically integrated monopoly that has a market advantage. Like they were given a market advantage with rebates, and that was meant to just go and bring down drug costs. All that did was inflate drug costs, and they started pocketing more. And then they became vertically integrated after the ACA because the conglomerates, the insurance companies, wanted to move all their profits over the PBMs because of the medical loss ratio. And so they started doing that, and then the PBMs are under the spotlight, and as Antonio's report just showed, they've started moving all their money over into specialty and mail-order pharmacy while making their other services, oh, look how cheap these are if you go with our mail-order and specialty package. And so they're placing all their profits there while everyone else is getting paid next to nothing. It's hard to fight against because it's whack-a-mole, and it really comes down to they just need to fucking pay us, like set reimbursement rates, go ahead and break up the conglomerates, and you're going to take care of most of your problems. You want to bring down drug prices? Get rid of the kickback exemption. Get rid of rebates. We could bring down prices. The thing that a lot of people don't understand is that back before rebates, brand drugs were not all that expensive. People would opt for brand drugs all the time and just pay out of pocket for them. It wasn't a big deal. Whenever people actually had to pay out of pocket for drugs, drugs were cheap. There was an actual market. What we're in right now is not a market. It's a perversion. And anyone that supports, and that's why I laugh so much, because you've got the Chamber of Commerce coming out and just like beating this drum about free market, when what they're really supporting right now is, I mean, it's really just straight up communism. So, and they rail against anything that even smells like that. So What do you? They need to pick a lane.
Right. So, Jeremy, is there one PBM that's harder to deal with than others? Or are they all terrible?
Oh, they're all awful. But outside the big three, once you get to the mid level and the lower levels, they're a little better for employers. Most all of them suck with reimbursement just because. How else are these smaller ones supposed to compete whenever the larger ones have their MAC list and they're keeping everything down? They're moving profits over to their mail order specialty pharmacies. The other PBMs are forced to lower reimbursements just to try to keep up and compete. So there's this pressure on the market all across, and it comes down on us. We're the ones that are providing value into the healthcare system, and the people that are making all the money are the people extracting value from the healthcare system. And that's just a house of cards. We can't continue this. If we continue it, the train wreck's going to just get worse. We're already witnessing a slow motion train wreck, and it's like we're just piling on additional trains behind it. We have to stop this.
And have you had anyone from Optum or Express Scripts or CVS Caremark contact you to say, look, we want to work with you?
Oh God, no. Besides, their little, committees that they'll get together to try to act like they're doing something and they wave it around to lawmakers. They love to do that. But no, as far as actually working with anyone, if they form a committee to do something, they straight up tell us, don't even bring up reimbursement. Don't do this. They don't negotiate. They don't care. And
so they have no intention of working with independent pharmacists is my question.
No. They want to try to, right now, their big thing is try to get us to do a lot more clinical work and bill for this and bill for that, for things that we already kind of do at a glance. And it creates more paperwork, and more paperwork's good for them because guess what they get to bill for? Paperwork. And they get to justify their existence with the problems they create. It's racketeering. It's straight up racketeering. But they're doing all this while we're struggling, and no one is, we are getting attention now. It's been years of work, and we're finally getting attention, but it's something that has taken years of education with lawmakers. It's taken a lot of pharmacies dying to get this attention, and that's what's so unfortunate. And to all the pharmacies out there that have went down, like, we're fighting every day, not just to make it better for those of us left, but we want to come back and we want to fucking put a knife in them afterwards. And we want to claw back everything that we can for the pharmacies that didn't make it because they deserve to be made whole.
So I love that. And I need our independent pharmacists around because as an independent physician's office, I feel like we're going to suffer the same fate that they've been doing to the independent pharmacists. But
they're coming for you next. Like,
they're
gobbling everything up. Yeah,
they are at my door. I had an interesting situation recently with United Healthcare, and they were underpaying us for an infusion drug called Absola by $400. And as soon as we realized that was happening, we infused the patient one more time. And I said, you've got to go to the hospital. He's like, I'm not going to the hospital. I sent the order, Dr. Box sent the order to a standalone. They lost $700 on it. The standalone came back to me and said, I don't want this patient. And I went to United Healthcare and said, this patient doesn't have anywhere to go. He sent in a grievance, and United Healthcare, they came back to me and they actually gave me a single case agreement and retroactive it to when I lost the original money in 2023. So I know it can be done, but you know what? Most people don't have the energy to play this game, and I barely do.
No, not the energy, not the resources. And that's why it's important with what the FTC is doing right now. Their study and the power that they have, they can actually make a difference without having to placate a lot of special interest when it comes to lawmaking and legislation, because we'll get some great bills going on at state level or federal level. And a lot of times PCMA will come in and they're very good because guess what? They have a ton of resources and they can spend a ton of money on their lobbyists, and they can come in and they can just alter language a little bit or, they can alter language a little bit or just get one person, like we're seeing in North Carolina with Phil Berger, where a bill passed the House unanimously, SB 246, passed the House unanimously, would pass the Senate unanimously, but he's holding up the bill and he won't bring it for a vote. And I don't know what he's doing with political leverage, but I'm getting a group of North Carolina independents together, and we call it the Incendies. And we're creating grassroots efforts in all states. And in North Carolina, I've got a guy, Wes Hickman, who's doing some great work down there. And we're making some plans because we're not going to be able to match their resources. They have money. I mean, they're basically European countries that exist in our country. They're large organized crime. We can't match their resources. That's why we got to be smarter than them, because the truth and the data, it backs us up. It does, but that's not enough. We've got to resonate, and we've got to have a message that resonates, and we got to drive it home. And so that's why I want to make it more painful to ignore us than any campaign contributions would be worth. We're pharmacists. You're a physician. Whenever we go out and we speak in our community, people are more likely to listen. We're community leaders. It's not just like some random person complaining. So you get a bunch of us out there complaining in public, protesting, you get us out there interrupting dinners, people are going to pay attention to that. And if we get a network, calling it the PUD Action Network that I'm putting together across states, we're going to get this network together that we can all support each other, and we can hit back and put pressure on them, because like I said before, you have to make it more painful to ignore us than it is to take the PBM money.
I love that. What can we do? What can the physicians' offices do to support you?
Biggest thing you can do to support, communicate with us. That's huge. If you could come in and become physician members of PUT, that would be awesome. We're always trying to get new members because we're trying to organize. We're trying to also fundraise, because this is a full-time job for me. I spend just as much time doing this as I am in my pharmacy. And, I do it for free. And, we travel all over the place and we do all these things. Any resources, even a little bit every month, it goes a long way for us. And we're getting new members every single week because, we've stepped up and we've really, really put our limited money. We've really put everything where our mouth is. Sure. We're coming out and we're punching them in the face, and pharmacists are sick of, playing nice and playing diplomat all the time. And they love us because that's what we come out and we say how it is, and we get in people's faces, and that's why we resonate.
Well, and playing nice doesn't work. Okay. I mean, I am the mean one. Okay. And unless you tell people what you want and tell them strong and get these patients to stand shoulder to shoulder with you, there's no needles that are going to be moved. Now, I maintain we're never going to have a needle move in Missouri because Express Scripts owns this town. But Claudia is the young generation. What can the young generation do to support? She goes to an independent pharmacy.
Oh my gosh, I love my independent pharmacy. I walk up, the owner's like, "Oh my God, I love your hair." And I'm like, "Thanks, we're best friends." And then I'll walk up to the counter and they don't even need my name at this point. They're like, "Have you been to any protests?" And I'm like, "Where were you guys? You should have been there." But he'll notice a new medication and he's like, "This is a new one. Like, do you have any questions? Do you like," whereas Walgreens, I'm sitting in a drive-through waiting line for 3 hours to get a call from her that the employees walked out. So I'm just waiting there for nothing. And it's, how do we spread the word that Walgreens isn't your independent pharmacy? CVS is not, because I feel like they're almost all put together. People don't realize how big of a separation and how detrimental them going to CVS is to independent pharmacies.
One of the biggest things that I think the younger generation can do, and it's kind of happening with pharmacy more, and now it's happening with physicians more, is get involved with like the anti-monopoly movement. I'm actually having Matt Stoller, which was a huge pull on my podcast right after this on a PBM on the Rocks Live, and I'm really excited about it because I've always followed this stuff. But follow this because it's not just our industry; it's across a lot of industries. It's just ours is more pronounced, and it's awful because they're pretty much killing people and killing businesses to make more money. Like, they run a money printer on patient blood. That's really how it is. And what you're doing right now, Claudia, you're spreading awareness. You're doing a great job on social media. You're going to your independent pharmacy and you're saying up on what's going on. That's exactly what everyone needs to be doing. not to plug myself too much, but watch PBM on the Rocks. Like,
Oh,
we get
yeah.
into it. Like, we really hammer it in, and we go over what's going on in the pharmacy world and all the abuses that are happening. And the PBMs right now, they're gobbling up physicians' offices left and right. Well, the conglomerates are, because guess what's going to happen whenever scrutiny comes down on their mail order or wherever they want to move it? They're going to move it over to their clinical arm, and they're going to start making money that way while they're squeezing us still over here. And they'll start going after that, and they'll try to gobble up as much as they can. And guess where they're going after that? The last bastion, the hospitals. And even the hospitals won't even be able to defend themselves from it. They're just going to be too big. And once they start getting hospitals, they're going to go to the government. They're going to be like, that whole single payer thing. Yeah, let's go ahead and do that Medicare Advantage style. That's their entire goal. And we have to stop it now because we've waited too long, and it's hard enough to stop. And if we don't stop it here, I don't see how we can unless we have a full-on healthcare collapse, which I kind of think is happening right now.
Well, I think my generation's really good kind of about spreading the word. Like, we have TikTok. Yes. I saw a study from KFF that TikTok is the leading like healthcare like informational
amazing
upon Gen Z. We have Reddit. We have every Tumblr. We have everything. So it's like just educating as many people as we can. And I think we've really educated a lot of people just on all of the burdens that happen throughout the whole time. So it's like, you want to know why it's taking so long for you to get the prescription your doctor sent in? We got a 12-page prior auth.
Right. Yeah. Of nonsense.
So it's not their fault. It's not our fault. And it's like the insurance company sits there and gaslights. And we're like, the doctor didn't send it.
Yeah, we've got a 12-page, 72-question prior auth on an $11 cash pay medicine. But your insurance is going to have you pay your $50 copay for this nonsense. And the doctors are going to pull out their hair. So it really is a jam job.
Yeah, we spend more money right now trying to keep drug costs lower and prevent fraud, waste, and abuse than we would just fucking paying us. And they've created an entire administrative system where they justify their own existence. And it's just going to continue. It's going to get more complicated. More care is going to be denied because that's how they make money. It's not going to stop unless we stop it.
Right. She spoke with someone, a complaint department, or what was it? And
at Blue Cross Blue Shield of Illinois. I spoke with a guy called me because, you can't get a real person on the phone over there. And I said, listen, we resolved the case that he approved. And I said, oh, listen, by the way, I have another Blue Cross Blue Shield of Illinois case. I was hoping you could help me with that. And he goes, listen, lady, we have 200 people on our complaint team. And this was not like some $20 an hour guy. This was like a legit business person I was speaking with. Now, Blue Cross Blue Shield of Illinois would rather hire 200 mid-level managers to fight complaints than just do the right thing.
Yeah, because they get to justify all their fees and everything else to the employers because of that. They're like, oh, economies of scale. Fucking economies of scale. They love their fucking bullshit economy words. Economists are some of the dumbest assholes to ever exist. They don't live in the real world. They live in textbooks. They don't see what's going on the ground level. And they're just like, oh, but look at this market mechanism. You don't see how it's actually working in the real world. Oh my fucking God, they kill me with that bullshit. And then you argue with them. You're like, literally, like, this is the real data that's happening in the real world. And they're like, you just don't understand, which is so great right now because there's so much vindication. The FTC's coming out with a report. Years of me going on being like, you all don't understand what is happening right now. You're taking everything they're saying at face value. And they're like, no, I don't think you just understand our healthcare system. You think I don't understand the healthcare system. Turns out Jeremy's right. So I need all of those health economists to line up and kiss my ass immediately. I want tongue. I want everything. I deserve it.
Oh my God.
Great.
Hey, I love this. I mean, Jeremy's very passionate about it, but we are going to have to put like a warning so children under 22 can't listen to this. Okay. Yeah.
That's how PBM on the Rocks started. They had me on the podcast one time and I got drunk and just started going and everyone was like, yeah, that's a pretty good idea. You should have him do that.
Listen, at least it's not some flat, buzzword, word salad bingo of nothingness. Like, tell me we're going under because of Express Scripts, Caremark, and Optum Rx. That's the problem. If we remove Optum, CVS Caremark, and Express Scripts, because we don't need those three middlemen, we can go ahead and conduct business.
But efficiency, synergy, all them shits.
No, not efficiency.
You almost had me ready to go, yeah.
No. Okay, let me ask you this, Jeremy. Have you ever had any direct contracts with employers for pharmacy services?
No, but our president, Deb, does that. I almost did a contract with Virginia Tech. That's a long story. Most of my stuff before COVID, I did really well, and I didn't have to have a ton of scripts because I'm located like 2 blocks from campus. So I had nothing but private insurance, and private insurance was still paying really well. So my entire business model was based around that. Well, they started squeezing private insurance, and now it's like, well, this sucks. I guess I'm taking a pay cut. Like, it's awful. And it's so like,
they expect you to make it up on the stick of gum.
Yeah, they actually say that during like state hearings. They come in and they're just like, oh, don't worry. They use their pharmaceuticals as a loss leader and they make it up by selling front-end items. The fuck we do. Who uses millions of dollars in inventory as a loss leader to sell knickknacks? It's bullshit.
Yeah, it is. Yeah, it is. Okay, well, one of the things that we were working on is direct contracts with some of the employers to bypass the insurance companies and the PBMs. And we actually have several. And so that's kind of a new thing because I'm all about, I would actually rather work for a chicken for physician services than I would for billing all this stuff and doing medical records and the clawback and everything. I'd like to get back to the old days where you come to my office, you pay what you've got, and we trade. But I know, right? Like, but I think the direct contracting potentially has some impact. And I know there's some people up in Wisconsin that are making some really good inroads there. What else is your message to the people that listen to Don't Back Down? What can you tell
Money
us?
636
and our TikTok people?
My big message is come out, support us, support the fight, learn what's going on, support your independent providers because if we're gone, there's not going to be anyone that's standing up for you. When we're gone, they're going to run over everyone else. We're going to have to stick together and we're going to have to do this together because it's something that's going to require all of us. And that includes, well, my entire idea is I think that we need to completely disrupt the payer industry. They're the most vulnerable. They talk about bringing in AI to disrupt like clinical services and everything else, like a computer can do what we're doing. But really all they do is run a fucking spreadsheet and they think they're not disruptible. Like all the health tech people, they're like, oh, we can do this. They're thinking wrong. Think about how you can go at them. Because if we find a way to just make it super easy for employers and plan sponsors all over to in-house their benefits and be super hands-off, that'll make it cheaper. And that'll make sure that we're all paid well. It's going to make sure everything's good. That's the way we need to go.
Well, I think the pump is prime for this with some of the lawsuits that are coming out for the lack of fiduciary duties and the CFOs of self-funded plans like our friends at J&J getting sued by their own employee. I mean, I like J&J, but they've done her wrong and they've done their employees wrong by mandating 2 Express Scripts. So I think that the synergy is decent. In my lifetime goals here, and I'm on the tail end of my career, I am going to go out screaming and yelling the truth, which is we need independent pharmacists. We need independent physicians for access to care. Every one of us is a patient and every one of us should have a choice in who we get prescriptions and healthcare from. And we don't because of the vertical integration and the one size fits all bullshit. Now I'm starting to talk like you.
Yeah. We got to come at them. We got to have a full plan. We got to have legislation to make sure that we've got baseline reimbursements. We have to come at them. We got to try to break them up. We got to hit them with the regulations, with the regulatory bodies. We got to hit them with the FTC, try to break them up, FTC, DOJ. We got to come out with a full-on market alternative. Like I'm saying, we got to make it easier for employers to in-house all their benefits. We got to do that. We got to do a fucking regulatory purge. We have to go up because there's so much regulatory capture in HHS, in state Medicaids that we've got to get the people that are industry people, we've got to put pressure on them to quit pushing all of these policies that are so pro payer industry. We've got to do all that, and we've got to have a message that resonates. That's how we get out there, and that's how we hammer it.
Healthcare shouldn't be denied.
No, healthcare shouldn't be denied.
Right. It shouldn't.
For what we're paying right now for healthcare, every single person should straight up just get every single bit of care they need without paying a dime. That's how much the government alone is paying for it. Plus, we're all paying a lot out of pocket. So,
right.
Why is this happening?
It's happening because of the few people making the decisions. They're so far away from the pharmacist and the patient and the physician and the patient that they don't give a rat's behind anymore.
Yeah, however, and they're all making a lot of money.
Yeah, they are. Yeah,
including those campaign donations and special board appointments and favors all over the place.
Right. Well, let's continue our conversation. I really appreciate your time. We will join PUT. Make sure you do that. You join PUT, however we can do that.
And maybe we have like a quarterly podcast meeting where you let us know.
I'd love to do that.
Well,
like, you all are awesome. Your entire social media game, just like ours, pales in comparison. Like, I've got so much to learn from you all.
Really? Well, you know, we're streaming you on our TikTok right now too.
Hey, TikTok people.
They love you.
Actually, Claudia's the reason I got a TikTok back, because I saw she was doing a live for you all. And I was like, oh, that's cool. They're doing a live. I was like, I like the stuff that they do. Oh, that's cool. And I was like, I like the stuff that they do. I'm going to get on and like watch it and support it. I got on, there's like thousands of people watching it. I was like, fucking shit. God, I knew they were popular. They knew what they were doing, but fuck. Like, I got lots to learn.
Oh my God. You know what, Jeremy? Well, we got a cease and desist letter from Cigna. So big multi-billion-dollar international company Cigna is worried about what my little rinky-dink office in Bridgeton, Missouri is doing. You know we're doing something right. Okay,
exactly.
So we pivoted to her 8th grade social media on TikTok, where she started.
Twitter. I started on Twitter, and it was C_money 636 in high school, because 636 was my phone area code.
C money.
Yeah.
Yes. No.
So we went from 100 followers on TikTok to we're almost at 19,000, and Mark Cuban follows her.
That's awesome. Mark's great.
Yeah. So we're going to definitely push all of this out, and whatever else we can. We're going to have a quarterly meeting with the Lord Jeremy, and you let us know when the next protest is, because have a whistle, we'll blow. We will stand shoulder to shoulder with you and be there, because this is really important, the work you're doing, and I appreciate it.
I appreciate you all. Yes, you can be a Lord. Just get drunk and order it online.
It's like when my daughter ordered a minister collar and a clergy bumper sticker online. It's really like not a big deal. Jeremy, thank you for what you do. We will be in touch. See you later.
Quarterly meetings.
I'll see you all. You're awesome.
Bye. Thank you.